Hi, my name's Pshields, and I'm a physician here in Western New York. And I just want to thank Crosswater Digital Media for giving me the opportunity and the platform to share some of my experiences that we've had with COVID-19 here in Western New York. Early on in this, back in March of 2020, there was a desire to create a subacute care unit for patients who weren't going to be able to go home from the hospital, but who remained positive for the virus. And out of that, we identified that one single organization was not going to be able to create that solution. So, in a definite deviation from how healthcare is practiced prior to coronavirus, multiple independent organizations came together to create a solution. And I want to thank Kaleida Health, Erie County Medical Center, Elderwood, skilled nursing facilities, and general physician for bringing people together to produce a solution that has been successful. We have been fighting the coronavirus since it came, and we've done it very diligently and very deliberately and at great expense and effort to all of the involved organizations to provide care with the seeming goal of only improving quality of outcomes and improving patients' level of care. That's what we were focused on, and that driving force allowed us to create a solution that has saved countless lives in the subacute setting and long-term care setting. We created a very specific unit that has 22 beds and is managing patients with skilled nursing care as well as early physical and occupational therapy. We're seeing patients for speech therapy, and we're providing them with aggressive care and some novel therapies that we think have really been successful. One of those things is vitamin C. We're using moderate and high dose vitamin C for patients because we believe that it helps to optimize their immune system, specifically certain cells within the blood cells and the white blood cells that help to make the immune system more efficient. We believe that, and anecdotally, we've seen significant success with that. We've managed nearly 80 patients through our subacute unit who are COVID positive, and the vast majority of those patients have returned to their prior level of function or better. Unfortunately, as is the nature with this disease, we've also had some bad outcomes. We've had some patients who have succumbed to the disease along with their comorbidities, but that incidence has been minimized, dramatically minimized. And I just want to be able to share with the population, because if you pick up the newspaper or you watch the television, you're going to see that if you go to a nursing home or a congregate living facility, you're at great risk to perish from this disease. And I will tell you that if you do it right, with competent medical care and amazing nursing and therapy staff like we've accumulated at our facility, you will survive this and you will thrive through this. Giving patients a full line of sight and directly affecting this virus, taking it head on and beating it is how we win. And we've had great success. So the gross generalization that going to a nursing home with coronavirus, you'll perish from this disease, is inaccurate. But you need to be diligent about finding facilities and finding healthcare providers that are going to have your best interest at heart. These patients are at great risk to have all kinds of complications from all kinds of illnesses. And what we need to do is be an advocate for patients. We need to have a direct line of sight to worry about their quality of life and their good outcomes. And we need to come away from the politics and the finances of healthcare. You cannot put a price on someone's healthcare. And we've had great success working with payors, both nationally and locally, on giving us some leeway and freedom to keep patients in the level of care that they require and get them better and get them back to where they need to be. That level of cooperation needs to continue in a post-COVID environment. We need to continue to work together to provide care for patients where they need it, when they need it, and by the right people to provide it for them. There needs to be communication that opens and cooperation across the community. I want to make myself available through email or telephone contact. Reach out to me through Kaleida Health or General Physician or through Elderwood, and I'm happy to share the best practices that we've developed. There's so much more than just vitamin C, and so much of it is simple medical care with good outcomes. I'd love to share best practices. I'd love to open a dialogue with any of the providers or operators in the space that want to do better. I don't believe that I know everything about it, and it doesn't have to be my way, but I would love to have a conversation and be at the table to share what we're doing and hear what other people are doing and move through this. Coronavirus is not going to go away. We need to figure out how to deal with it, how to get people where they need to be, how to get them better, and how to optimize their quality of life. And we can only do that working cooperatively. We will have accumulated knowledge on this virus to a significant degree as time passes, and we need to be open and sharing and develop those pathways now so that we can be ahead of this and we can win in the fight against coronavirus. Thank you.